A pleasant day and a warm welcome to your favorite show, iMed. Ladies and gentlemen, we were discussing about certain disease conditions throughout a series of programs, and today through our iMed program, we are going to enlighten a specific aspect of heart diseases, which is none other than the surgical aspect. Right. So as ordinary citizens, you might be having heard about certain disease conditions and certain other conditions related to the heart, even to one of your close family members. There might be surgical procedures, there might be certain procedures which can be corrected by medicines. Enlightening on the surgical aspect, there are certain rumors and false impressions. So we are going to discuss about the surgical aspect of heart surgeries today through our iMed program, and we invited Dr. Rajitha Y De Silva, consultant cardiothoracic surgeon. Thank you very much, sir, for accepting our invitation. And so we have heart surgeries, numerous types of heart surgeries, and people have certain concern over heart diseases. First of all, as a cardiothoracic surgeon, can we enlighten the general public? Is it a certain matter to get afraid?
Well, heart surgery, I don't think you have to be really afraid of, because why I'm telling like that is, now if you look at the heart surgery, the risk of heart surgery is now less than 1%. But if you go back to history a little bit, about 100 years back, people thought you could never operate on the human heart. That's 100 years back. It's a short history. Now over the last so many decades, we have been doing so many heart surgeries, and the technology has been advanced, and people have been doing many heart surgeries, and now the risk is about less than 1%, I would say. But the success rate of heart surgery is almost 99%, but depending on the patient condition and the severity, it depends. But we operate on the very high risk patient as well, and even we go up to the level of operating on the heart where the heart function is about 30%, normal heart function is about 60%, and we have go up to the level of doing the keyhole heart surgery. That's a high end of heart surgery, and even the heart transplantation and the artificial hearts, and there are other newer technology like arrhythmia heart surgery. So much has developed, so I don't think we'll have to worry about it. But if you don't do the heart surgery, then you have to worry about it.
Right. Okay. Yeah. Now let's have a formal exposure to our topic. Yeah. Can you just explain about heart diseases?
Yeah, Charita, do you think I can quickly go through what is the heart is like?
Sure, yeah. No problem.
So heart is actually like the engine of the human body. Can you compare to that? Because if the engine stops, heart stops. The vehicle stops. So like that, if the heart stops, the life will not be there anymore. So heart basically what it does, it pumps the blood, which carries the oxygen and the energy to each and every cell of the body. So that is the function of the heart. It acts as a pump, but at the same time it's a muscle made up of specialized tissue that's called cardiac tissue or a heart muscle. And inside the heart there are 4 chambers, and there's a left and right. So the blood comes to the left side, pumps out of, that's a clean blood, oxygenated blood, which pumps out of the heart, goes to the whole body. Then the oxygen and the nutrient in the blood which has been used by the peripheral tissue and the body. Then you get the unclean blood to the right side of the heart. Then it goes to the lungs and clean it up. Then comes back to the left side. So that's a cycle. So if you go back to your original question, what are the diseases? Now, to heart muscles to pump, it also needs energy. How you get that energy is from the blood which comes to the heart itself, muscle itself. So what it carries is the coronary arteries. There are 2 main arteries to the heart muscle. Those are called coronary arteries. So the commonest disease we get is in the what you call the blockages or the narrowing of these coronary arteries. That is called atherosclerotic disease or atheroma formation in medical terms, but in later we can say that's a deposition of the fat, cholesterol, lipids and calcium on this coronary side. So these blocks or narrowed down, so there will be less blood supply to the heart. The heart cannot pump the blood as it wants. So that's the number 1 disease. That's the coronary artery is the commonest one. And so other diseases are the valvular heart diseases, which is, I told you there are 4 chambers, right? So each chamber is connected by the valves, mitral valve, tricuspid valve, aortic valve. So like that there are valves. Those valves can be narrowed or valves can start leak. can be start leaking. So that also needs sometimes surgical correction. Then you have the valve replacement and the valve repair. The valve repair and valve replacement also, there's a difference, and types of valve we can discuss it further. And other types of surgeries are, then there are hole in the heart where the right side and the left side blood is get mixing up. Usually in the left side, as I told earlier, it's a clean blood, but in the right side it's a bit of unoxygenated, or we can say blue blood. And those two can get connected if there's abnormal holes. That's called hole in the heart. That also can be addressed surgically. And the other thing is, you can get the arrhythmias in the heart. That's usually you get in the heart the lub dub sound. That's a regular rhythm. But if the rhythm become irregular, that's called arrhythmias in the heart. So arrhythmia also, they are a kind of surgical treatment. And the next level is then when you get the end stage heart failure, when the heart is failing, when the heart function become 30% or less than that, there are heart transplantation and the artificial heart assist devices, that kind of treatment also available. Those are the spectrum.
And so like when it comes to the normal functioning of the heart, you said that this certain blood flow mechanisms and the coronary arteries which supply blood to the heart is there, and how does the normal function deviates when there is a disease condition? Can you just specify us to the general public?
Your normal function deviates from the...
Yes.
Yeah. So basically what will happen is, now for the heart to act normally, there should be enough oxygenated blood should come to the heart. But what will happen if there is a narrowing of the coronary arteries or or blockages? What will happen? There will be no enough blood supply to the heart. Enough oxygenated blood won't be come to the heart. So then the heart will start having a pain. So that's why you get the what you call angina. When you walk or exert yourself, you get a chest pain, and once you rest, then the pain will go off. So other thing what can happen is, when there is a less blood supply to the heart function can gradually go down. That's another thing. So the heart function will gradually come down. So the other option is, other thing what can happen is, suddenly there can be blood clot inside the coronary arteries, and it stops the, which completely shut down the blood supply to the heart, that particular artery. Then you will get what you call major heart attack. So that area of the heart, the muscles will die if you do not do anything immediately. So that's what called major heart attacks.
And so like some people in any type of a disease, we know that there are certain symptoms, there are certain indications that exhibit certain types of disease. You said about a pain running through the left side, and are there any other certain things that we can specify that this might be a heart disease?
Yeah, well, answering that question is, now it's depend on the what kind of disease is having. Now for example, the commonest thing is the coronary artery disease, where the coronary artery is blocked. The typical pain is, it's a central chest pain. It's the middle of your chest. You get when you walk up and down, when you exert yourself, you get a tightening kind of chest pain. It may be burning, tightening, heaviness. Those are the kind of pain you can get, and it relieves with when you are resting. So that's a typical pain of angina, but it can radiate along your left arm as well, or can go up to the jaw. So that's a typical. But in addition to that, there are atypical presentation where you can get the pain in the left side of the chest, right side of the chest, in the in the abdomen, in the tummy, where you think it's a gastritis. That's a major mistake people do. We think it's a gastritis, but actually it happens to be a major heart attack. And also it could be a bit of shortness of breath and a bit of arrhythmia, palpitation. Anything could be from the heart disease. And if you get that chest pain which lasts more than 30 minutes with the severe pain, it's a sign of, it could be a heart attack in the late terms, but it may be a, what you call in a myocardial infarction in medical terms. So those are the sinister things. So if something like that happen, you need to go and seek for the immediate medical advices. But having said that, just another small thing, but people with the diabetes, bad diabetes, they can have a silent attack. Yeah, actually that's mean you don't feel the pain You don't know you are having a heart attack, but actually you are having a heart attack. That
So
also
what
can
is,
happen.
can you just explain us a little bit on that as well, sir, the silent aspect of being related with diabetes?
Yeah, because when you have a bad diabetes, what will happen is your nerves can get damaged, your pain sensation won't be there.
Right.
So you are having heart attack inside the heart, but it won't manifest as a pain.
Right.
That's what you call silent heart attack.
That means the specific mechanism is happening, but due to the diabetes, the nerves get damaged, and that particular pain, which is given rise by that cause, is not exhibited.
Not exhibited. For example, the people who is having the leg wounds, you know, people have the diabetes where you get the peripheral neuropathy, the nerves to the leg and the foot, it's damaged. So people walk on the, you see, they won't feel it.
Right.
They won't feel any wounds. So that's why some people having the leg wounds, and they won't know even when they have the wounds, when they have bad diabetes.
This program, as you are specialized on that particular context, sir, we will enlighten the general public about the surgical aspect. That means the operations simply. And at what time do we need a surgery for the heart diseases, depending on the certain disease conditions?
Yeah. So basically, when somebody get heart disease, the first instance is they will encounter with the cardiologists who are specialists in the heart, and they will, now for example, the commonest thing is coronary artery disease or atherosclerotic disease, the blockages of the coronary arteries, what we called it. So then they will go to a cardiologist and they will do a certain test. They will start from the ECG, echocardiogram and exercise ECG, then end up doing an angiogram.
Right.
So in the angiogram you will find certain blocks, maybe one artery block or the second artery block, or maybe 3 or 4 blocks, and depends on the type of blocks, how severe is that, and what are the numbers of blocks. Then cardiologists, and usually it has to be done by what you call heart team, where the surgeon, cardiologist and the interventional cardiologist sit together and decide what is best for the patient. It happens sometimes in our country also. Then we will decide what is the best way forward. It could be a medication, just drugs treatment, or maybe a stenting. That's
Right.
done by a cardiologist, where you put a stent inside the coronary artery and expand that blockage. Or if it is not possible by those modes, so they will come to a cardiac surgeon or cardiothoracic surgeon, somebody like me, and then it's an indication for surgery.
Right.
Yeah.
Yes, go ahead, sir.
Usually with the three arteries being blocked, or the main artery is blocked, and especially with the diabetes, low blood, low heart function. So those are the people who are suitable for heart surgery, which is not amenable for stenting.
Right. Okay. So, and when you're explaining about the surgical perspective, there were certain types of surgeries that are performed, as you said. One was that the valve operations. Can we just have a certain enlightenment on that?
Yeah, valve operations. So basically, there are 4 valves inside the heart. In the left side, you get the mitral valve and the aortic valve, and then the right side you have tricuspid valve and the pulmonary valve. So basically, commonest operation are the mitral valve operation and the aortic valve operation. And the valve pathology also could be 2 things, as I told you earlier, maybe stenosis or regurgitation. That's mean narrowing of the valve or the leaking of the valve.
Right.
And so what happens is, when the valve is leaked or stenosed, so we can take off that valve and put a new valve. That's what you call valve replacement. When you are doing the valve replacement, there are 2 kinds of valve actually. One thing is mechanical valve and the other one is a tissue valve. The tissue valve means is this valve is taken from a cow or a pig.
Right.
The advantage of the mechanical valve is it will last longer, but since it's mechanical, metallic valve, once the blood flows through that valve, it tends to get blood clots. So therefore, once somebody having a mechanical valve, the metallic valve, you have to go on a blood thinner called warfarin.
Right.
Right. But if you put a tissue valve, then it doesn't need any kind of blood thinners. So patient does not need to have warfarin. So especially elder people, like after 60, 65, people usually go for a tissue valve because they don't have to be on a blood thinner.
Right. Okay.
Yeah, that's the difference. And other thing, when you talk about the valve operation, you should know about the valve repairs. When it comes to mitral valve, it's always better to go for a repair rather than a replacement, whenever it's possible.
Right.
Yeah.
Okay. And so, like you said, certain suggestions, tissue valve or a mechanical valve, can the person itself, being the patient, suggest that can I have this type of a valve?
Yeah, of course, that's very interesting question, important question, because when you are decision making, it's actually not the doctor who decide what's the
Right.
valve. It's a combined decision by the, but our duty as a doctors explain what is this valves and the pros and cons, and the patient party and doctors, they all have to, and the family has to come together and decide what is the best valve. For example, there are young people like about say 20s, 30s sports personalities who want to play competitive games like rugby, football. But that kind of people, if you put a mechanical valve or metallic valve, what will happen? They have to be on warfarin, so they can't go and doing the competitive sports because they tend to bleed. So that kind of people go for a tissue valve, because then you don't have to take blood thinners. They do not have to take blood thinners, so you can go and do the competitive jobs. But the problem is in the tissue valve, it will last only for the 10 or 15, 20 years.
Right.
Then that's mean younger people, they have to go for the second operation after 15 or 20 years time.
Right.
So there are so many sports personalities in other European countries and states, that kind of countries, they have gone for tissue valves and they go for surgeries later on.
Surgeries. And a small question, sir, when it comes to the tissue valves, you said that from 10-15 years we need to have a certain replacement. Will it become malfunction suddenly?
It won't. It's a gradual thing. What they say is about there's something called structural deterioration of the valve.
Right.
After about 10-15 years time, usually it start in about 40 to 50% of people.
Right. Okay. So that is clear for you all. That will be a gradual decline of the function that won't stop suddenly, and don't be afraid of going for surgeries, because not going for surgeries is the risk. And so like you talk about stenting, and let's talk about a practical exposure. And some people, they have certain numerous blocks in the heart. For example, certain like 5-6 places have been blocked, and there is a percentage given like 99% is blocked. Likewise, some people say that our doctor said that stents are not possible. Is it so, sir?
Yeah, if it is major blocks, the number of blocks are higher, then it's better to go for a bypass operation. But it's an individual decision. But just assume Charita now, very elderly person who's got so many risk factors like bad kidneys, and he can't walk and immobilize, so that who is not really a good surgical candidate, who can withstand the surgery. So that kind of patient, though there's a 9-10 blocks, there's no point going for a surgery, the chances recovering from surgery is very minimal. So in that kind of case, yeah, it's a good candidate for stent.
And can the person itself, the patient, being the patient, suggest that without going for heart surgery, doctor, can we have a stent and see? Like, is it a good trend to give suggestions at that type of a situation?
Well, this has come to another aspect called consenting, informed consent. So as doctors, our job is to inform the patient, okay, this is what is the best for you, depend on the current evidence we have. But at the same time, you must tell these are the other options patient have, other option they can go for. When it comes to the blockages in the coronary artery, the bypass operation, stenting, and the medication. Bypass operation also, there are off pump, on pump, and the keyhole surgeries. And yes, after knowing that everything, after informing all those facts and the possibilities and the option to the patient, after having understood, he can have a dialogue with the surgeon or the cardiologist and decide what is best for the patient. And yeah, he can always suggest, I can't say no, but there are situations where the patient is suitable for bypass operation, but because of the patient is afraid of surgery, they might say, okay, I won't stent. But then our duty is to explain to the patient, okay, this is the risk of surgery, you don't have to worry, and assess the risk of surgery and explain to the patient. Then most of the time they will understand and they will go for surgery. But there are people, they will come and say, no, I want the surgery, not the stenting, because of some bad experience. But if it's not, if it can be stented, then we should always tell them, okay, you should go for a stenting, because if there's only one block or two blocks which is nicely stentable, then there's no point opening the chest or doing a keyhole surgery.
Right. So that paves the me for the next question, sir. Like, you are specialized in this cardiothoracic surgeries and you are a consultant cardiothoracic surgeon. So you have numerous experience about the open heart surgery. So can you just comment on that?
Yeah, open heart surgery is, what do you mean by open heart surgery is you open the sternum. Your sternum is in the breastbone, that's in the center of your chest. We open the breastbone and then we access into the heart and then do the heart operation. There are a few ways you can do it. The conventional way of doing it is we connect the heart to the heart-lung machine. So that means we stop the heart and the function of the heart and lungs are taken over by the heart-lung machine.
Right.
That's called on-pump bypass operation. And so advantage of that surgery is heart has stopped and very, there's no blood at all, so then you can do a very smooth and fine job, but the heart has stopped and blood goes through that machine. The next one is the beating heart operation. The beating heart operation is where the heart is still beating but you have access to the sternum. Right. So through the open way, and while the heart is beating we do the bypass operation.
Right.
That's called beating heart or off pump surgery.
And you are specialized on keyhole surgeries. What is the difference, sir?
The keyhole operation is where without going through the sternum we make a small incision in the left side of the chest about this much and then we access to the heart from there. Right. And then do the surgery.
Same thing.
Yeah, same thing.
Right.
But not each and every candidate is suitable for keyhole surgery. Right. And we can do the operation from there.
So what is the concept of hybrid surgery is there?
Yeah, very good. The hybrid is actually the best in both worlds. That's what the hybrid means.
Right.
And what we do is, for example, just assume there are 2 or 3 blocks, one in the left side and other one is in the right side, where we can access from the keyhole surgery. We can do maybe 1 or 2 blocks, then there may be another block which we cannot access from the left side of the heart or from the keyhole approach. So then the cardiologist, interventional cardiologist will go and do the stenting there.
Right.
So the stenting and the keyhole surgery combination is called the hybrid operations.
And as the latter part of the program, as a final question, I would like to enlighten you, sir, about the heart to heart, the charity program that you are going to exercise.
Yeah, the heart to heart is our charity. We have been working for the last 8 years. So basically what we are trying to do is, our mission is nobody should die of a heart disease in this country due to financial difficulties. So we are trying to help people with the poor financial background. So that's what we do. Our heart to so far we have done about 450 patients through the heart to heart trust fund. Something I want to stress at this point is there something called Abedani program. So Abedani program, what we do is we appeal from the public of this country who can spend money for their birthday parties or whatever, for remembering their beloved parents or maybe functions. What do you think? Why don't you? What do you think about sponsoring one patient, save somebody's life once in a year? Spending that patient who can't afford the surgery, you can just help them to get their surgery done. Then you are saving somebody's life. I'm sure there are about 365 people in this country who can spend that much money once in a year.
Right.
Yeah.
So with that, the general public can involve. If you are giving some sort of a donation, you can just support this charity as well to benefit the public who are unaffordable at the surgeries.
Yes.
Right. Okay. So with that, we are going to wind up today's program. We enlightened about you the surgical aspect of heart diseases, and there's the risk you are dealing with, and what are the complications and all those things. And you might be having a better sound knowledge about now what the heart diseases are and the surgical aspect. So thank you very much, sir. Dr. Rajitha Y De Silva, consultant cardiothoracic surgeon. Thank you very much, sir, for joining with us and enlightening on the cardiothoracic aspect and the surgical aspect, and even enlightening about the heart-to-heart initiative. So thank you very much, sir. And thank you very much for joining with us with the iMed program. Stay tuned with the rest of the programs as well. Have a pleasant day.